All right, so chapter 20 is promoting asepsis and preventing infection. Again, these content is not mine. I don't own this material. Under the fair use and providing lecture content only for my nursing students. All content within is for educational purposes and not providing medical advice. So, infection. Infection happens when a microorganism is capable of producing disease invades the body. Whatever microorganism that might be. It might be a virus, it might be a bacteria, right? So different kinds of bugs. So how does it invade the body? You've got to know this for the test. Every single test has something about this on it. So if you don't know the 6 links, you're going to have to memorize this. You are going to have to understand it very easily. So the top green link says infectious agent. So there's an infectious agent and it's living in a reservoir somewhere. The reservoir is the pool that it comes from. The reservoir is a place that it loves to grow. And then the portal of exit is like a sneeze, your airway. It lives in your airway. It loves it there. And then when you sneeze, there's the portal of exit. It's exited your body. The mode of transmission is how it got there. So air, droplet, saliva, body fluids, whatever is the mode of transmission. The portal of entry is into that person that gets it next. So the portal of entry into another person could be touching that saliva, smelling in those droplets, and that's how they get infected if they're breathing in. And then the susceptible host is the biggest part of this. So if they're already vaccinated, they're not going to get it. But if they are susceptible, they were going to get it. So during COVID, you saw this a lot. The susceptible host was somebody who was very young with no immune system or very old with no immune system. So immunocompromised makes you a very susceptible host. Okay? So that's kind of the chain, and you've got to know the links and how it happens, because what the test question will be is like, what's the portal of exit from a person? And it could be sneezing without covering, not throwing away tissues, things like that become the chain of the infection. So an infectious agent is a pathogen, could be normal flora that becomes pathogenic. They live in a reservoir where they love and multiply. And then what might be living would be, it might be living in a human, an animal, an insect. It might be non-living, such as food, floors, equipment, contaminated water. So just some sources that could be, and that's why you want to dump over any contaminated water or sitting water, because bacteria and things can be living in there. That's why housekeeping comes frequently. So the spread of infection, the 6 links, the portal of exit via what? Body fluids, coughing, sneezing, diarrhea, seeping wounds, tubes, lines, drains. The mode of transmission, the contact, was it direct contact or indirect contact? If it's direct contact, it's usually from touching, kissing, or sexual contact. So just assume all the STDs. You have to have sexual contact with that person to get that. That's not just something that flies through the air. Indirect contact is something with a fomite, so something that was in contact with their genitalia kind of things. Droplet, sneeze, or cough, and airborne is via air conditioning, sweeping, things like that. So airborne, they're on the air particles. They're very, very small. Droplet, it comes out and down to the surface, and then you touch the surface. So just another. The portal of entry could be their eyes, their nose, their mouth, the vagina. Cuts, scrapes, wounds, surgical sites, IV drainage tube site, or a bite from a vector. Just consider that like a bug bite, a spider bite, whatever. The susceptible host is somebody that has inadequate defenses. So, 4 determining factors: the virulence, so does the virus live outside the body? For how long? How virulent is it? How potent is it? The organism's ability to survive the host's environment. So, if the host has a lot of defenses, then it's not going to live. The number of organisms and the host's defenses. So, some stages of infection. First is incubation, so kind of like incubating chicken eggs. Incubation means the time that it's growing, so the time from infection till manifestation of the symptoms. You can infect others during this period. So, when you become COVID positive, you've already been spreading it as a positive person for a couple of days. Prodromal means before. So prodromal, appearance of vague symptoms. Not all diseases have this stage. Illness is when the signs and symptoms are actually present. The decline is when the pathogen number is declining. And then convalescence is in the terms of tissue repair, returning back to health. You're in the convalescent stage. You're still sick, but you're feeling better. Classification of infections could be local or systematic. Systemic have gone through the system, they're all the way through your body. So think about a local infection. A local infection would be here on my arm, in my UTI, in my bladder. It's localized to one place. But a UTI can spread up the tract into your kidneys, and you can die of sepsis very quickly. So, systematic, just think systematic. If it's all through my system, it's been spread by blood or lymph or potentially spinal fluid, right? Think of something that goes all over. So, when it affects many regions, it's called septicemia, septic. If you're septic, it's gone through your blood and it's pretty much attached to every single organ. It's a wake-up call. So there are signs and symptoms that we talk about with sepsis. Sepsis is something that kills you very quickly. When you are talking sepsis, you are talking blood pressure is gone, heart rate's gone, you're dead. Your temperature is very high and then goes very low. You're done. Okay, so you want to catch those infections when they're local at all possible costs. But some people, like elderly or not verbal patients, will show up to the hospital in sepsis because it's gone too long. So the classification by duration, you always want to think to yourself, is this a rapid onset, an acute, is it a chronic, or a latent? So this gets a lot of people on the test questions, so you need to know this, and you need to think about this in your head when you're answering test questions, because if it's an acute condition, we want to treat it right away. If it's a chronic treatment, it's been with the patient forever. It's probably a lifelong disease now. Okay, so something acute, the cold, the flu, acute asthma exacerbation. Okay, acute means in the moment, I need to treat it now. I need to treat it first. A chronic issue has got slow development, longer duration, like osteomyelitis, osteoarthritis, things that take a long time to develop and they're not going to go away. They're only going to get worse with time. So chronic COPD. Chronic, long term. So if somebody chronic disease, unless it says a sudden something, it's probably not the patient you want to see first when you're prioritizing. Chronic diarrhea, not as concerned. It's an IBS, it's an irritable bowel. If it's an exacerbation could mean an acute problem. we would need to treat that. Okay. Latent is infections present with no discernible symptoms, like HIV. So eventually the infection will die out, but it's still present, but they're not having any symptoms because they're being controlled with the HIV drugs. Okay, clicker check. A client living with AIDS develops oral hairy leukoplasia, an infection caused by the Epstein-Barr virus. Leukoplakia is considered a nosocomial infection, a primary infection, a systemic infection, or a secondary infection. So which one do you think? Which came first, right? So I would go with, so the word nosocomial means in the hospital. We gave it to them. Primary infection would be his AIDS. His AIDS infection made him susceptible to a secondary infection. Okay. So secondary means something else became immunocompromised and now I'm susceptible to this second one. An infection requiring healthcare issues, those are nosocomial healthcare related infections. Also, not a big fan of those because that's something we caused and it's a leading cause of death. So it would have been preventable using aseptic principles and techniques like hand washing, cleaning the site. So these are pretty costly to us, so we're constantly looking for cleaning things, cleaning sites before we get into the IV, peri-care on a UTI from a Foley catheter, okay? So anytime there's something in the body that's not supposed to be there, it has increased the risk of infection on that patient. So we want to get those out as quickly as possible. So it could be exogenous. Exogenous means outside of the body. So outside the body, a pathogen that was acquired from the healthcare environment, which would be a UTI based on you putting in the Foley catheter. So it wasn't in their body to begin with, it's from something we did. Surgical site infections, things like that. Endogenous means the neural flora multiplied and caused the infection as a result of the treatment. Endogenous, I have normal flora that now multiplied and caused an infection. Okay. Endogenous within. So the lines of defense against infection, the primary infection defenses we have are intact skin, mucous membranes, tears, normal flora in the GI tract, and normal flora in the urinary tract. So a UTI, a GI happened because it overwhelmed our normal flora. Our normal flora works for us on a daily basis. We don't even think about it. It's when those things are not happening that it becomes a problem, and then we get sick. The secondary defenses are biochemical processes activated by chemicals released by the pathogen. So phagocytosis. Phagocytosis is like the eating, eating away. Complement cascade, inflammation, and fever. So that's why you don't want to always treat every fever that you see, because that's actually the body's defenses coming to our help, helping us in the disease process. Some factors that increase infection risk: the developmental stage of the person, the breaks in the skin, illness, injury, chronic disease, smoking, substance abuse, multiple sex partners, medications that inhibit or decrease the immune response, and nursing and medical procedures. So these all increase the risk. And then factors that actually support host defenses, adequate nutrition. So the cells need to manufacture the immune system response. So the immune system response is very well known defense that we have. So think about vitamin A, C, and E, right? When somebody's getting sick, they go running for A, C, and E. A, C, and E is those vitamins that help us rebuild tissues quickly. They rebuild the immune system. Balanced hygiene, sufficient to decrease the amount of skin bacterial count, but not overzealous, which would cause skin cracking. So hand washing, hand washing, hand washing, but not to the point of having blisters and bleeding skin, dried out skin. Rest, exercise, reduce stress, and immunization all helps us to help our defenses be better. Preventing infection, so medical asepsis. Medical asepsis, a lot of the times, is clean hands, clean environment. It's a state of cleanliness that decreases the potential for the spread of infections. So we always want to make sure that we have a clean environment, take out the trash, clean environment, wipe down the table, clean environment, clean bed linens, clean toilets, clean bathtubs, anything like that. Clean hands, and then following the guidelines of the Center of Disease Control. So the CDC is the entity that makes all isolation contact precautions. So we definitely will talk about that. Maintaining a clean environment, cleaning spills, dirty surfaces, removing pathogens, disinfecting, removing clutter. Consider supplies brought into the patient's room as contaminated. As soon as you bring it in the patient's room, it can't leave again. So if you bring a Foley catheter in, you have to leave it in there. Okay. Consider items for the patient's home to be considered as contaminated as well. So if somebody brought something from home, we'd also have to decontaminate that as well, disinfect it. Wash your hands when you arrive to the unit, when you leave the unit, before and after using the restroom, before and after eating, before and after client contact, before and after contact with client belongings. Wash your hands, wash your hands, wash your hands. Wash your hands before gloving, after gloving, before and after you touch your face, before and after eating, after touching a contaminated article, and when you see visible dirt on your hands, wash it down. Okay? You cannot stress hand washing enough. Wash for at least 15 seconds in a non-surgical environment, 2 to 6 minutes in a surgical setting. So we'll see that when we go into the NICU or the OR. The OR, you are going to do even more hand washing. Hand washing for medical surgical units is usually at least 30 seconds, minimum 15. So removing your jewelry, cleaning beneath your fingernails, no fake fingernails. Fake fingernails, fungus. Fungus is growing under them. There is no fungus among us. We take those fingernails off. There are no more fake fingernails. Think about that too with your fake eyelashes. Use a bactericidal solution or use water if the hands are visibly soiled. Use warm water, not hot, not cold. Warm water will always be the answer on the test question. Apply soap to wet hands, not dry hands. So you need to start the water, get them wet, then put on. Use friction. So we usually do between our fingers, the wrists, up the arm a little bit, and then come back, do every single nail. Use your nails against the palm of your hand. Use friction, say the ABCs, rinse with soap, towel, or hand dry. So clicker check. Which of the following actions violates a principle that is key to proper hand washing at the bedside? Washing your hands for 1 minute, shaking your hands dry over the sink, use warm, not very hot water, or using the soap provided by the agency. Which one violates? Which one violates that protocol? So You are not, you are not to shake your hands dry over the sink. You know we all do it, right? Especially when we don't see any towels in the area. We all do it, but that is not appropriate in the healthcare setting. So when you get to hand washing in the medical setting, just remember not what I do at home. Okay? There's nothing wrong with washing your hands for a full minute if you feel that they're still dirty. Go ahead. Use warm, not hot water. True. Use the soap provided by the agency. True. So everything else was true on this. The one that violates means false. So when you're taking a test question, think about true or false. What is it that they're making me look for here? Okay. Implementing the CDC guidelines, standard precautions across the board. Standard precautions protects us from exposure. It decreases the transmission of pathogens, and it protects clients from pathogens carried by healthcare workers. So it's standard precaution every day of your life. Contact precautions are used when you have a pathogen that's spread by direct contact. Think MRSA, think C. diff, think any of those. So that pathogen is spread by direct contact. You have to have contact with draining wounds, secretions, supplies, things from that patient. So precautions include possibly a private room, clean gown and glove use, disposal of contaminated items in the room, and double bagging all linen and mark them. So typically the possible private room is only a point when you don't have somebody else with that in the unit. So C. diff and C. diff can room together. C. diff and MRSA cannot room together. Those are two different organisms. Airborne is on air currents, so it's transmitted via ventilation systems, shaking sheets, sweeping. So you don't want to make waves. When you're making waves, it's spreading. So those are same as contact, but the addition of a special room, a special mask, and a mask for the patient when transported. So those precautions equal contact precautions. So you would wear a gown, a glove, a mask. The mask will be a special mask. The mask will be an N95 because the particles are smaller. And the mask needs to be on the patient. A standard surgical mask would be on the patient for transport. Okay, clicker chick. If the client has a draining abdominal wound that has become infected, in caring for the client, the nurse will implement so an abdominal wound draining that has infection. Right there, I'm looking at contact precautions. Droplet, it does not say that it comes in droplets. No precautions, that wouldn't be true. And airborne, it does not say that it's in the air. So I'm going with contact precautions. Because when I contact the infected drainage, that's what I'm going to get in trouble. Droplet. Droplets spread by moist droplets. Droplets come out and go down to a surface because they're heavy. Droplets are coughing, sneezing, touching contaminated objects. Precautions include also like contact, but the addition of a mask and eye protection. The mask has to be a surgical mask and eye protection within 3 feet of the client. So you have to have a mask with a guard on it for your eyes. Protective isolation, a protective environment protects the clients from organisms. So this is your chemotherapy patients, your special situations with immunocompromised patient population. So this would also be your patients waiting transport of an organ to them for transplantation. Precautions include the room with special ventilation and air conditioner filters, no carpeting, and wet dusting every day. Avoid standing water in the room like a humidifier. The nurse is not assigned to any other clients with active infections, and you're going to have standard transmission-based precautions plus a mask plus other personal protective equipment to protect the patient. Nothing leaves the room in those cases because you want to dedicate that equipment just to that patient. So a thermometer doesn't go in. They have disposables in the room. You solidify that. So surgical asepsis, we are going to talk a little bit about it, and then you won't see it again until we do suctioning and Foley catheters. But surgical asepsis means another form of sepsis, asepsis, where you have to be careful with sterile stuff, okay? So everything you learn from this time forward is going to be sterile environment. Sterile environment needs to be clean, needs to be very, very sterile. That's different. That's when we put on the gloves and stuff. You will not do anything sterile until we get to oxygen day and Foley catheter day. For right now, you just know that this sterile environment means that you can't be in there, you can't have airflow in there. There's sterile equipment and supplies. Each one of them is specially wrapped. The sterilization of reusable supplies goes downstairs to central sterile and gets reprocessed. There's a surgical hand rub, there's surgical attire, there's sterile gloves, and a sterile field, and the use of sterile technique. So not touching things with your sterile hand. You're working as a nurse on a med-surg unit. What roles might you play in the chain of infection? That is, what links might you be? Think about it. Have a good day.